So let's grab Joe and look at his case first. Joe, you there?
Yep, I'm here.
Hey, welcome, sir. Tell us about your person here.
So 51-year-old male chiropractor. Um, Chief complaints are low energy for about the last 5 years or so. Weight gain over the last, I believe, year. Just mentally overwhelmed from owning his own business. Currently taking Armour Thyroid, testosterone cypionate, and HCG. He started the testosterone and HCG protocol to help with some of the energy issues, the brain fogs and things like that. So he was trying that. His testosterone levels tested down at the lower end of the normal range. And that's when he started the therapy for that. So his biggest thing, I think, is just feeling overwhelmed, stress, and low energy, which I think he attributes to probably age, but not necessarily. Lots of emotional stress, just from work in general, I think is probably the biggest thing. Sleep pattern's not very good. He's never been a good sleeper. Pretty much all of his life it's been, 4 or 5 hours of sleep a night, and usually that's kind of an interrupted sleep pattern.
How long has he been in practice? About 10, 15 years or more?
16 years now. Or actually, no, close to 20 years now.
It's so interesting to me because I talk to doctors every day now, and I would say for medical doctors, chiropractors, I see this with nurses and nurse practitioners, around the 10 to 15 year mark, people just start to burn out, I mean, they really do. It's a hard job. If you're in a hospital as an MD, if you're in a chiropractor, you're running your own business, it just starts to weigh on people, I think. It's pretty hard to maintain all the balance that we need to stay healthy, when we're under this kind of pressure. I think it's almost inevitable,
Absolutely, yeah. So looking at his tests, when I got the tests back, I looked at that and just looking at the overall low cortisol levels and then the DHEA levels. My assessment was he's into a phase 3, but I think he's in that phase where the DHEA is going up, so kind of in that six block. On that one graphic that you showed a couple weeks ago, I think there's that little jump there. And so that's kind of my assessment, but this is my first one, so.
Oh, yeah. Well, absolutely. The other thing is that, when in a perfect world, people seem to feel their best when the DHEA is up like around an 8 to a 10. So you have a certain number of people who have DHEA like 3, 4, 5, maybe even 6, who are pretty burned out. And I think the tiny little bits of DHEA, the really, really low dosages that we use for the stage 3s, are totally fine to give to someone because it's such a small amount. So even if the DHEA is a 5 instead of like a 1 or something like that, I think it can still help quite a bit. And if you can boost it up to like 8, 9, or 10, it can make a pretty big difference in how people feel. So even though it's not technically low, you can definitely still use it like you set up in your program.
Okay.
Here. And that's the nice thing about these dosages being so low is that it's pretty hard to mess things up. And the other thing is that, you can do the pregnenolone. 6 is on the lower side. If you want to be more conservative, you could go up to as many as 15 drops 3 times a day.
Okay.
Somewhere between 6 and, I would say somewhere between 10 and 15 is usual.
Okay.
Somewhere there, depending on how sensitive the person is. Sorry, I'm scribbling
there.
10 to 15, something like that.
Okay. And how would you assess the sensitivity to the pregnenolone?
I usually start them off at like 12 or 15, and then if they, it's not that common that people complain about it, but sometimes people feel like it gets them a little wired or they can't go to sleep if they take that much of it or something like that. Okay. They'll tell you right away. You could just say, hey, if you have any negative side effects, we'll lower the dose, but most people tolerate it pretty well.
Got it.
All right.
Okay.
And let me grab Duncan had a question too. Duncan, you there?
Yeah, hey, morning.
Morning.
congratulations on the study. That's super exciting news, and
Thank you.
you know, research always builds on research. So having Kalish method be sort of the example to lead the way, I think, is pretty exciting. My question is about a case that we actually reviewed a couple of weeks ago, and since that time, so it was a woman, 65-year-old, who had a total cortisol of 2 and a DHEA of 1, and is complaining of fatigue and irregular circadian rhythm. Since that time, I've did a consult with her, and I remembered from working with her previously that she had some history of cancer, and it turns out that in 2012 she had chemo and radiation for a triple-negative breast cancer, and that was like technically resolved, and you know, she is stably in remission. And my understanding is that triple-negative breast cancers are not hormonally active in any way. Would you still be cautious using the pregnenolone or DHEA in a cancer case like that? I mean, it's like she got her legs kicked out from under her by the chemo and the radiation. And, you know, I think she said that it was basically after that that she never felt the same. I'm just wondering how to set expectations with her for treatment, how I should design the program with a triple-negative type of cancer.
You know, it depends. Like I've always had an excessive paranoia about giving hormones to people like DHEA and pregnenolone that could even ever remotely be construed as making cancer worse. When you really look at the research and you talk to the people that work in integrative oncology a lot, DHEA is actually considered cancer protective, not cancer causing. Pregnenolone, maybe people don't think about as much because hardly anyone uses pregnenolone. But if anything, DHEA is considered as something that people use to help prevent cancer, not that it would be a trigger for it. But I've always been on this excessively cautious side of things. If it's a hormone-related cancer in the first place, if it's not a hormone-related cancer, then the DHEA is even less controversial, I think, especially in the dosages that we're talking about.
Do you think it would make sense to have her like clear the usage of the like she really wants to use the supplements because she really wants to feel better as soon as possible, and I said that you know, I would bring it up on this call, and that you know, and then I did quite a bit of research myself on that type of cancer, and it doesn't, you know, it lacks any receptor sites on the cancers for hormones, but I was sort of thinking maybe I would have her, I mean, she must be being screened once a year or something for what's going on now. I thought maybe I would have her clear it with her oncologist or something if we were going to use those products. You
could do that. I mean, that's an easy way to do it. Or you could focus more on organic acids testing and the energy-producing nutrients that are on that side, because those I think have zero controversy. You know, things like
it was
CoQ10 and that kind of stuff.
Mm-hmm. Okay. And I mean, you know, anything. I mean, I suppose I could use licorice to try to boost cortisol levels a little bit, because like I said, her total cortisol was a 2.
Yeah, the other thing that I've done in those situations in a non-hormone related cancer is just say, hey, you know, let's just use this, but let's retest every 3 months instead of every 6 months, so that will, you know, take you off it when you start to feel better and when your labs look better. So it's just clear that you're monitoring the person really carefully and you're only going to use it for as long as they clearly need it.